Okay, so when you're pregnant, your body is going through a ton of changes, right? And one of the most common, and let's be honest, kind of confusing, is an increase in vaginal discharge. You might be wondering, is this normal? Should I be worried? Well, that's exactly what we're going to clear up in this explainer.
So let me ask you this. If you're pregnant, have you noticed, well, more of it? If you're nodding your head right now, you are so not alone. This is hands down one of the most common things that happens during this time.
And listen, here's the big takeaway I want you to hear right at the top. For the vast majority of people, this is completely 100% normal. Seriously. It's actually a good sign that your body's doing its job to protect you and your pregnancy.
All right, so let's dive into why this is such a normal part of the whole pregnancy journey. There's even a fancy medical term for it, which we're about to get into.
And that term is leucorrhoea. I know, it sounds super complicated, but it's really just the official name for that thin, milky white discharge that you tend to see more of as your pregnancy goes on. See? Putting a name to it kind of takes the mystery out of it, doesn't it? It's just a totally standard thing your body does.
So, what does this normal stuff, this leucorrhoea, actually look like? Well, it can be thin or a little thick. The color is usually clear, white, or maybe a really light yellow. It's often got a kind of milky texture. As for the smell, it should be pretty mild, maybe a little musky, but definitely not foul. Oh, and it's also super common to see a bit of light pink or brown spotting mixed in, especially in those early weeks.
Okay, this is probably the biggest question on your mind. How in the world do you tell the difference between what's normal and what might be a red flag? Let's break down the key signs side by side. Think of this as your personal checklist. So on the normal side, you're looking for clear to white color, a mild smell or no smell at all, and you shouldn't feel any discomfort. Now, look over at the abnormal side. These are the warning signs. We're talking gray, yellow, or green colors, a strong, fishy odor, or any kind of itching, burning, or pain. That's your body basically sending up a flare saying, hey, something's not right here. But why does this happen? What's going on in your body to cause all this? Well, the science behind it is actually pretty simple. Let's take a quick look. For the normal stuff, you can thank your hormones. During pregnancy, you get this huge spike in estrogen and progesterone. That increases blood flow down there, and boom, more discharge. It's just your body's natural housekeeping system, keeping everything clean and protected for the baby. Now, on the flip side, if it's abnormal, it's usually pointing to an infection. You see, those same pregnancy hormones can sometimes throw off the natural, delicate balance of bacteria and yeast in the vagina. And that can, unfortunately, make you a bit more prone to these kinds of issues. And this chart breaks down the 3 most common offenders. What's really helpful here is that each one has a pretty distinct telltale sign. So, for bacterial vaginosis, or BV, the big giveaway is that grayish color and a fishy smell. For a yeast infection, you're looking for that thick cottage cheese texture and, some pretty intense itching. And then there's Trichomoniasis, which is an STI that often shows up as yellow or green and has a foul smell. Knowing these specific signs can be super helpful.
Okay, this leads us to the most important part of this whole conversation, knowing when it's time to call your doctor. And here's the golden rule. When in doubt, check it out. Seriously, don't ever hesitate if you're feeling concerned.
So, just to be super clear, if your discharge turns green, yellow, or gray, if you notice a bad or fishy odor, if you're dealing with itching or burning or any pain, especially when you pee, it's time to make that call. It's always better to be safe and get a professional opinion.
And this is a really important point to make about bleeding. A little bit of light spotting can be normal, but if you ever experience heavy bleeding, like period-level bleeding, that is an emergency. That requires immediate medical attention. Anytime you're unsure about bleeding, just make the call. It's the right thing to do.
Okay, so what if you do have an infection? What happens then? And maybe more importantly, are there things you can do to prevent them in the first place? Let's get into our final section on treatment and prevention.
So the key here is to get it treated early. And the best news is that most of these common infections are really easy to treat with medications like antibiotics or antifungals that are totally safe to take while you're pregnant. So there's no need to panic.
And you know what? There are also some really simple, practical things you can do to help keep everything healthy down there. We're talking about small changes, like wearing breathable cotton underwear, avoiding harsh soaps or douching, and even thinking about adding some probiotics to your diet. These little things can make a huge difference.
Now, this slide really shows why getting checked out early is so important. If these infections are left untreated, they can sometimes lead to more serious issues like preterm labor or a low birth weight for the baby. And look, we're not showing you this to scare you. Not at all. This is about empowering you with knowledge. Getting treatment quickly is the absolute best way to protect both you and your little one.
So after all of that, I hope you're feeling a bit more confident about what to look for. Understanding your body isn't about creating more worry. It's about giving you the power to take the best possible care of yourself. And really, that's what a healthy, happy pregnancy is all about.